So we're talking about myocardial infarction, and I was describing the signs and symptoms of myocardial infarction, of which I was talking about the pain. They have this substernal chest pain that radiates to the shoulder, to the arm, to the jaw, to the neck, and to the back. Now, these people do not just have this chest pain. This pain can also be like the worst pain of their life, and they have that feeling of impending doom. And then they can also have a pale, cool, dusty or moldy skin. Dusty or moldy skin because there's no blood supply to the myocardium or to the heart. That's why their skin will start looking pale, cool, dusty, or moldy skin. They can also have anxiety. They will even be sweating, cold sweat, be coming out of their body. Now, myocardial infarction can occur in two forms. We have what we call the ST segment elevation myocardial infarction and the non-ST segment elevation myocardial infarction. For the ST segment elevation myocardial infarction, that's the STEMI. This one is an emergency. It's very dangerous. In ECG, or when you're doing your ECG, like electrocardiograph, you will see that the ST segment of the ECG machine will be elevated in the heart, and that's a very serious one. That shows that this patient, the extent of damage and duration of this damage to the myocardium is really high. And then there's also non-ST segment elevation. The ST segment is not elevated. This can be a milder form of myocardial infarction. That's also like a means of diagnosing myocardial infarction. How else can we also diagnose myocardial infarction? Troponin will be elevated. Troponin level will be elevated. Also, the CKMB, the creatine kinase MB, these ones are enzymes that are being released by the muscle, will also be elevated. Remember, we have three creatine kinase. We have CKMM, CKMB, CKBB. Now, for the CKBB, this one is for the muscles of the brain and the lungs, while the CKMB is for the heart, and then the CKMM is for skeletal muscle. So we just need to know that. Now, what are the risk factors for developing this myocardial infarction? Number one, obesity. Number two, alcohol, excessive alcohol consumption. Number three, smoking, caffeine, theophylline, all of these things that they are very toxic to the heart. Yeah, they can also cause myocardial infarction. Then, if this patient has a history of cardiovascular disease or family history of cardiovascular disease, it can predispose this individual to having myocardial infarction. Also, diabetes, hypertension, these ones, they cause the narrowing of the artery, and because the artery is being narrowed, there will be no enough blood supply to the myocardium, causing that intense excruciating pain. I hope we understand.